DailyClout. I'm very pleased to welcome Dr. Kory to the program. Dr. Kory, thank you so much for being here, and I'll just let you introduce yourself.
All righty, Tana. Yeah, nice to see you. And I'm Dr. Pierre Kory. I am the founder and chief medical officer of the Frontline COVID-19 Critical Care Alliance. It's a nonprofit, right? We're dedicated to essentially developing the most effective treatment protocols for all things COVID, prevention, treatment, long haul, and post-vax. And then I also have a private practice that I founded, and I have a partner. Our name is the Leading Edge Clinic, and we focus, again, on treating COVID, prevention of COVID, and then really most of what we do is we specialize on treating vaccine injury syndromes as well as long haul syndromes. And that's been kind of my main interest and focus and efforts over the last year. I kind of have 2 full-time jobs, plus a public advocate or something, because I'm constantly being asked to speak and testify and stuff. So it's been wild.
Well, yeah, it's been, I'm sure, a crazy journey. And unfortunately, I'm sure your clinic is busy, and I'm sure that, there's a demand for more clinics like that to be opening up. But at least we have people like you guys who are frontline, really early on, front and center, trying to find cures for what they told us was the cure, and just ways to look forward and approach health in a new way. Let's talk about, if it's okay, you published an article yesterday in the DailyCaller. It is really fantastic. It's called, "Here Are 3 Unforgettable Lessons from the COVID Pandemic." So if you could just give us a little bit of the background of this article. You gave 3 very specific examples, which I like because it gives direction. It doesn't just call out a problem.
Oh, yeah. I mean, there could be, 100 things I've learned since the pandemic, but we kind of chose 3. And I'm just going to be honest and blunt with you. I mean, it's a little bit of a fantasy article, right? I mean, to pretend at this point, I mean, my cynicism over the capture of the agencies is really, there's no limit to that cynicism. And so the idea that, they're going to learn these lessons and apply them is a little bit pie in the sky. But, if they were, right, if we had a functioning system who did an honest review of what they did, one of the lessons would be, you got to be transparent. And I mean, this is just really difficult to talk about, but like, you understand that the kind of the central mission of the Centers for Disease Control is literally data collection and sharing, especially around infection control, disease spread, and all of that, right? And the amount of suppression of data that they have done is I'm not going to, hopefully I don't overuse this word, but it's in my mind, a crime against humanity. Not only have they suppressed data, but they manipulated the data. And we've been told false data from the beginning. And the manipulations start really at the ground level. One of the big manipulations that's not often talked about, I don't know if you know about this issue, but categorically and systematically during the pandemic, patients arriving to the hospital with COVID, if they were vaccinated, their vaccination status was not correctly documented. It was documented in a nursing note, and it didn't show up in their immunization record. So you have an entire country that is, the people in the hospital, the vast majority documented as unvaccinated when they were. And this is the data that the CDC parrots, right? And so and then the vaccine injury, I mean, the biggest crime, right, is the instant and categorical just ignoring of VAERS data, which is not new in public health, right? I mean, we've watched decades now of vaccines adverse event data being ignored. What they did instead is they attacked their own database as being uncredible, right? And there's nothing to see here, right? And you saw this skyrocketing mountain of adverse events and deaths. But so that just shows the criminality and who's really running public health. I mean, they're not, it's not public health they're interested in, but let's say we had a functioning public health one. That's what they would do. You want real time, transparent data and acting on that data, right?
And I mean, if they're attacking their own database, what good is it to begin with? Like, why does it exist? Why did you create it? For what purpose?
Because they had to, as part of, I think, the 1986 Act, and so it has to be there. But they don't want they've been knocking that database since it came out as. Don't ignore it. It's not credible. And actually, there's only one limit. There's only one definite problem with that database, and that is woeful underreporting. That's all it is. I mean, when you look at the reports in that database, which the underreporting factor in some cases have been estimated between 40 to 1 in terms of the deaths, and in other adverse events, it's 100 to 1. So for every report, you can multiply the total amount by 100. And I think last count, there was well over 1 million severe adverse events. Last time I looked, just in the US, it was 18,000 deaths. And you know, when you consider, right, like a couple of, I don't know if the babies died of baby formula, but they take the baby formula completely off the market immediately, right? A car with a faulty muffler, they recall hundreds of thousands of cars, right? You know, a lettuce that might have E. coli on it, the entire, you know, supply of lettuce is pulled from store shelves. And then you see this catastrophe that they've caused by just completely ignoring the deaths.
I mean, and not only are they not recalling it, in certain cases, there are universities still mandating it for young, healthy 19, 20-year-olds. It's
to structure a public health response on a silver bullet, one intervention only that they not only hung their hat on. I mean, it was clear they had an objective. They wanted to vaccinate the country with a novel vaccine that's not tested in an immunologically insane notion, right? Two notions that it was insane to do this. Number one is the idea that you can vaccinate against a coronavirus, one of the most rapidly mutagenic coronaviruses, right? And yet they tried to do that. You know, within months, the variants had changed appreciably. The vaccines were failing, and they were supposed to update the vaccines. I mean, they were using the Wuhan strain vaccine well over 2 years into the pandemic. That's one. And then the other thing is, and this is from Geert Vandenbosch's work, you're not supposed to vaccinate in a pandemic. They're to prevent pandemics. You actually can make pandemics worse by throwing out vaccines that are rapidly, you know, outdated, and you can create new variants. And so those two things have created a catastrophe. So this entire obsessive focus on a vaccine with a near total suppression of looking at early treatment options. I mean, that would be one thing. It's like you want to do many different things, and then also look at the other silver bullets that they pulled out, right? The lockdowns, right? These insane public mask mandates that don't work, and you know, again, that's fantasy land. That's a wish list that they would do, right? And then the third was, you know, you gotta if you're making snap crisis decisions, you got to look at them, right? I mean, you have to understand, like, you know, I get it's in a crisis and you want to do things, but like the lockdowns, the mask, all that data around children, their IQs dropping, their, you know, social sort of comprehension skills are being lost, right? Keeping kids out of school, the destruction of businesses, right? I mean, if we had a functioning system, they would have quickly seen and seen, like, okay, maybe we reacted in fear. We didn't know what we were dealing with, but there's wealth of data showing that those things don't work. I mean, the lockdowns especially, they knew. I mean, public health experts around the world have been saying for years that lockdowns have no role in infection control. What do? We lock down. And so, like I said, although this is, you know, this was an op-ed published in a major sort of, you know, newspaper, you know, it's a diplomatic op-ed. You know, I mean, in reality, the way we're talking right now, I mean, I couldn't say what I really would want to say in that op-ed, right? Because, you know, people want to pretend that the institutions of society are still functioning. They still have an implicit faith and trust in those institutions. So that's right. Like, you know, it was almost like a thought exercise of, if we had functioning public health institutions and they were remediable and correctable, this is what they would do. But to pretend that that's the case right now is not. It's fair.
Well, I think that optimism lies then in places like your health clinic and so many of these other freedom movements and medical freedom doctors who are opening their clinics to help these people. So the optimism lies in, well, the medical freedom movement will adhere to these very important principles.
So what you're saying though is that's kind of actually interesting, because it's the real answer, right? Because if you look at that article, it's kind of trying to remediate the agencies. The real answer is what you just talked about, which is a parallel health system. Like
exactly,
we're never gonna take down that mountain. That's Mount Everest. It's granite. It's institutionalized in our government and in our society. They have immense power. I was hoping that it would crumble to ashes and then we could build something new, but I don't think that's gonna happen. So you're right. Those of us, like for instance, if you look at me and my career, I mean, I was a really well-known academic. I mean, I taught medicine, I published, I was at the tops of my field clinically, I was at a major academic medical center, and I left the system. I'm in a private practice. Unfortunately, I can't and don't take insurance. I charge fees. I think they're actually quite modest for what I offer. And
well, that just provides transparency, and it's very straight up. This is the cost. You're providing a service. It's, listen, healthcare and how much of it should be socialized is such a broad discussion. But what you're doing is the way forward for people who want absolutely nothing to do with the industrialized medical system.
There's no question. And I go speak at different conferences and health freedom organizations, and it's just astonishing how many people come up to me. I mean, they're terrified of going into the system. They don't want to go to hospitals. They don't want to see their doctors because they don't trust their doctors. Because every time they see the doctor is relentlessly trying to jab them, telling them to get a COVID vaccine for coronavirus that's super mild right now and has been for a while. It's just absurd.
I don't understand how they're not even embarrassed at this point to keep pushing it. It just it sounds silly, but maybe that's just because of the world you and I operate in. Let's move on to another topic, if that's okay. I mean, I love everything you're doing, but that brings us to this battle that's still occurring, and this really propaganda war between the institutions and these people trying to build honest and healthy way forward. Dr. John Littell, I saw on Twitter a couple of hours ago that his credentials were they stripped? Completely?
So, let me explain, because I think most people who aren't doctors don't understand the difference between. So he lost his certification at the level of the American Board of Family Medicine, which is different than your license through your state medical board. So one is just that you're licensed to practice medicine. The American Board of Family Medicine certification, it's what's called board certification. It's supposed to denote a higher level of either skill or knowledge. So you don't have to be board certified by those boards, but it's nice to have it. Traditionally, it used to be just be a mark of distinction, but it's actually still quite important, because what happened is it became a kind of a form of regulation, because many insurance companies, you can't get on their panel without being board certified. They want to say that everybody on our panel is board certified. So the fact that John now lost his board certification probably has real implications for the types of patients that he can see. He might get dropped from insurance panels. So it will impact his livelihood.
What about hospital privileges? Does it impact that?
So some hospitals do require all their physicians on staff to be board certified. Now, John does care for patients in the hospital and has throughout COVID. He mostly works as an outpatient in his clinic. So again, that's a good question. I don't know what his hospital is like. I know big academic medical centers like University of Wisconsin insisted that everybody on faculty was board certified. I don't know if private hospitals or local hospitals do that.
So Dr. Littell was certified by the American Board of Family Medicine, and that comes under the umbrella of the American Board of Medical Specialties, according to the super quick look I did before we spoke on here. And I want to find out where those ties lie, because with Dr. McCullough, he was certified by the American Board of Internal Medicine Foundation, and their ties went straight up to all of the big players who are right in bed with the pharma companies.
It's a mafia. I mean, the system is so tightly controlled and influenced. This is why we're all running into trouble. Remember, Peter McCullough's letter, me and Paul Merrick got the same letter on the same day. The ABIM went after all three of us on the same day. We got all the same letters, which was like these copy and pasted quotes that we had said in public interviews and our different opinions and insights into COVID. And they basically said, we're accusing you of misinformation. And they wanted me to defend the letter. And what was really interesting about that is my lawyer rightly pointed out to the ABIM that they were violating their own process for misinformation, which is they're supposed to send me a letter with all of the data showing that what I said was administered, they didn't do that. They didn't provide.
They just said of course they didn't, because they didn't have it, and they wouldn't have it.
I was so fed up, so exhausted. I was just like, fine, take my board cert.
So what happened with
that?
In
the end, we talked about it a lot with the lawyer and everything. And, I've been doing a lot of writing. If you look at my Substack, right, I've done deep posts on all of the data around vaccines, especially the inefficacy, negative efficacy, the toxicity, the lethality. So, I could bury them with citations for support what I said. And so our lawyer put together like a really long, highly referenced document with like all of the data of ivermectin's efficacy, hydroxychloroquine, all the stuff that they accused of us of misinformation. And I don't know, they have all the power. There's really, I thought it was an empty exercise, because I was like, it doesn't matter. Whatever data I show, they're gonna pull data from like peer-reviewed literature, which are essentially fraudulent. The stuff that's in the peer-reviewed literature, they all have predetermined results. Like, we know what gets published and what doesn't get published. Systematically, they censor, reject, and do not review papers which truly find the scope and the scale of the toxicity and lethality of the vaccines. And that's going back to the point we talked about before, is the doctors in the system, they subsist on a diet of the high-impact medical journals. And if that's your only diet and source of information, wow, that is the catastrophe we're in, because they're literally looking, they still have an implicit faith and trust in those journals. And by the way, you probably know this, Atana, but those journals were captured decades ago. And that's been written about in books by former editors of those journals. They've written books,
so upsetting.
And they left their posts because they couldn't deal with it anymore. They actually had something called integrity and ethics, and they resigned, and then they wrote a book about how you really can't trust what's in the medical literature. This is 20 years ago, and it's never been more true than in COVID. That corruption and control was just amplified in just the most heinous ways. And so they can pull any data they want to prove me wrong, but I would say that's not misinformation still, what I said. I have data to back up what I said. So, but yeah, go ahead.
Unless they've twisted that word so much that, when someone says this is misinformation now, I don't know which side they're talking about, because is it the people who are calling misinformation, or is it the CDC who's been spreading misinformation since day one of this pandemic?
And the thing is, you're allowed to be wrong. I didn't know that was a crime to be wrong, but the way I think they're defining misinformation is a deliberate intention to spread false information. So
there's the projection, because that's what they're doing.
Yeah, exactly. Well, I call them the disinformationists, and we're the supposed misinformationists. But it is ultimately a war of information, and
yes,
they can control the information and what gets approved and what is considered what's called sufficient evidence, right? Because by the way, I'll tell you a little funny anecdote. Do you know that I have a tattoo?
No.
So I have a tattoo on this arm. If I wasn't wearing an undershirt, I'd show it to you. But it's a tattoo that says insufficient evidence. And it's because I just had it. The way the game works is if you find anything to be effective, especially if it's generic, a natural or alternative approach to treating a disease, no matter how much data you can marshal, no matter how much expertise, clinical experience, they will say there's insufficient evidence. And that is how they just demolish and suppress anything but the pricey patented pharmaceuticals. Everything else has insufficient evidence. And then they'll do like one corrupted trial on like Paxlovid, and suddenly that's like regulatory approval, and the government writes checks for billions of dollars and buys, millions of doses. It's a disgusting system, never before been exposed. And Itan, I think you and I were talking about this before we started, but in my career, I knew there was probably corruption. We knew big pharma's got their fingers in the pie a little bit. And, we were always a little skeptical of stuff. And I'd lived through a fraud early in my career in the ICU. There was a drug called Zygris that was a complete fraud. And it took years for them to figure that out. But many billions had been spent on that drug, and it turned out to be dangerous. So I'd already lived through a pharmaceutical fraud. I didn't know the extent of the pharmaceutical frauds and how long they've been pulled off. And, so COVID now what I've seen and learned from becoming an expert in COVID And I could see, like, I literally, as an expert, I could see that the world was full of lies around COVID. I'm now estranged from it. I don't recognize medicine. I don't trust medicine. I can't read medical journals. At least the high impact medical journals. The second and third tier, actually, you can find good science, good honest science there. But the problem with the second and third tier journals is they don't drive headlines. You can publish a lot of stuff in them, a lot of truth, but they will never register at the media level, and people never learn about it. And I found that most lay people, and shockingly, most physicians, you know where they get their medical information from? Michelle Walensky actually said that she gets her, I can't remember the exact statement, but she said she got her COVID information from CNN.
Oh, yeah, I remember that one. Here's my question for someone who's been so in the thick of this, like probably every waking moment for the past 3 years. How high up does the manipulation go? Meaning, at what tiers are the doctors, at least on some level, honest doctors who just are too busy to have access to the fact that the studies that they're reading are highly manipulated? Like, they just don't have time to be aware of these things. And then how high up the chain does the unawareness change into manipulation and active censorship and active smearing?
Well, I show pretty high levels in my book because I really take ivermectin as a case study and I bust them on everything. Because I have tons of information on the behind the scenes stuff that they were pulling at the journals, the rejections, the retractions, the fraudulent trials, the fraudulent trialists. And I mean, you can definitely document as far as clearly big pharma. All of these investigators and trialists who conduct these counterfeit trials or fraudulent trials, almost all of their funding comes from pharma. So that's clear that pharma is the closest to the manipulation. But then you also have Bill and Melinda Gates Foundation. Their fingers are everywhere. The fingerprints are everywhere on tons of this stuff. And that's a massive global organization. I've also traced and documented manipulations of the evidence at the level of WHO, right? And so, like, how really high does it go, right? And then if you look at like Sasha Latipova's work, right, with the fact that this whole COVID response, this was not a public health response. It was a military response. All of the contracts with the vaccine manufacturers were from the DOD to the vaccine and it's not a pharmaceutical product, these vaccines. They're literally categorized as a countermeasure. It's a military countermeasure. They were fighting a war against what they thought was a bioweapon. And so when you look at that, I mean, you also can go to the heads of the military. I mean, this was a military response. They were at the top of the chain in directing the response. I mean, the National Security Council, the DOD. And so, like, I usually don't go that deep, but I mean, what I say is this, is that they used pharma tests. So when you talk about disinformation, right? So I always talk about this because it's really the theme and how my book is structured. But there's an article called the Disinformation Playbook. I don't know if you've ever read it. It's on a website by an organization called the Union for Concerned Scientists. And they wrote this back in 2017. And when I gave my ivermectin testimony, I couldn't understand what was happening afterwards because I literally thought, I didn't think we'd get a ticker tape parade, but I literally thought like ivermectin would be quickly researched, deployed systematically in the prevention and treatment of COVID. That's not what happened. You know,
the naivete we all had back then. I mean, if I would have heard of you, I would have been just as excited to hear about this as you were to present it. And it's heartbreaking to look back and see what actually occurred.
But now it's heartbreaking. And now I'm, like I said, now I've fully transformed. I've learned things and now I know and see things that I never saw before. But the start of it all really was in those months after my testimony. Like, lots of weird things were happening that didn't make sense. And they were very anti-ivermectin. They were going after us. And I was like, what's going on here? And then a researcher, a veteran, one of the most published researchers on vitamin D in the world, he sent me a 2-line email. This is March of 2021. And it said, "Dear Dr. Kory, what they're doing to ivermectin, they've been doing to vitamin D for decades." And he had a link to the Disinformation Playbook. And I click on it. And it was like, boom. Suddenly, everything made sense because the Disinformation Playbook is a very short article, and it uses the names of American football plays. So it's like the fake, the fix, the screen, the diversion. And they just describe what they do and have been doing for decades. It's when corporations encounter science that's inconvenient to their interest, they launch the disinformation playbook, and they start conducting fraudulent trials. They start censoring at the level of the medical journals any positive reports on a repurposed drug, and they just like laid out everything that I've been seeing. They go after the researchers. It's called a blitz, and they've been doing that for decades. Like pharma literally keeps hit lists of doctors who are putting out inconvenient science. They did this with Vioxx, like Merck did this with Vioxx. They were going after doctors who were trying to sound the alarm on the toxicity of Vioxx. And so I got to see, once I read that article, I was like, that explains everything. And then basically what I found was that myself and my organization, we were literally the tip of the spear in a disinformation war. And it's been a war on safe repurposed drugs. And it's been a war on promoting and protecting this crazy vaccine campaign.
Well, I definitely have to check out that article because I wrote an article last week. It's called Meet the Misinformation Busters, who they are, who funds them, and what they think of you. And it goes through. Basically, it sounds like the article you're referring to is one step higher than the article that I wrote, and it takes it one step back into the clinical trials before all the information gets out into the the people on the street and into the local churches, and all the money goes that way. So that sounds really fascinating, and I want to I want to look more into that. And your war on ivermectin is such a classic example of the manipulation tactics and the suppression tactics and everything we've been through. And what's so cool and so important is that this community is documenting this time period, like your book and all the books that have come out in the last couple of years, and Ed Dowd's book with the hard data, and of course the DailyClout War Room book with the actual Pfizer reports, and your documentation of ivermectin and Robert Kennedy Jr.'s documentation of Fauci and all this. We're creating an archive and a library of rich information that will hopefully help everybody propel forward.
I'm so glad that you said what you said, the way that you said it, because you literally articulated like my thoughts. Like after I discovered that this was a disinformation campaign against ivermectin, I was like, I am documenting every single thing of this. And what was really interesting is not that I'm an investigative journalist, but my network of expert colleagues literally spans across the globe. I know people in so many countries, deeply studied people, lots of different insights. And so if you read my book, it's almost like a horror movie, because I literally show exactly what they did. And I've had a fair amount of help from some colleagues who like learned things, dug deep, even some investigative journalists who looked into things. And it's like, you read my book, I basically show what they do, how they do this, and who does it, and how it's accomplished. And it's to do what you just said. I felt like the only thing I can do is expose this to the world in whatever way I can, but to protect people from being manipulated, from being lied to. I mean, you know how many people have died from these lies and the suppression of data? And like, I want the world to know that the world that they think they're living in is not the world they're living in. You gotta, almost like the alternative, the parallel health system. We need a parallel media. This one's been captured.
Oh, we are working on it. Substack. It is happening.
Substack, Itana, right?
It's Substack. It's DailyClout. It's Children's Health Defense. It's Del Bigtree. It's Steve Kirsch. It's all of these people, and it's incredible. And we're winning. Like, we have our little guerrilla warfare tactics that you can use against these people. And I look at the millions of doses they just threw in the garbage, and the flat rate of a bivalent booster uptake. And they're trying really hard, just because everybody is kind of starting to finally turn against them, like you referenced in the beginning of your article.
And it's interesting because maybe if you don't mind, I kind of want to talk a little bit about vaccines.
Sure.
It's what I do.
Yeah, please.
I like, the vaccine booster uptake, right, is like, it's plummeted, right? I mean, people have had it, right? And there could be a few reasons for it. Either they're like, they've all gotten vaccinated and still got COVID real bad, and they're just like, what's the point, right? They either figure out on the inefficacy, but the scope and the scale of the injuries are so massive. I mean, we know that from the V-Safe data. Literally 8% of people who got the vaccine needed medical care as the result of the vaccine. And just to put that into context, right? I'm an ICU doctor. I'm a lung doctor. There's not one procedure, intervention, or therapy that I've ever prescribed in my career that has even a 1% risk of needing medical care as a result of that. I mean, I've never heard of any medical intervention where 8% of people need medical care. And what the people who come to me, I kind of differentiate what happens around the vaccines into two camps. One is a post-vaccine complication, and the other one is a post-vaccine syndrome. Complication tends to be a single organ dysfunction or a single symptom or a single event that happens, like a pericarditis or myocarditis. What I see is patients with these syndromes, and I'll just describe it to you real quick. The three cardinal or core symptoms of the syndromes are severe and often debilitating fatigue, something that we call post-exertional malaise, which means at any time they do activity of any significant amount, and sometimes it's tiny, it's going to the mailbox down the driveway, their symptoms flare and their fatigue is just overwhelming. They'll spend 3 hours in bed after going to the store to get milk because they're absolutely demolished. So it's fatigue, post-exertional malaise, and then some sort of cognitive deficit, which we call brain fog, right? Processing, memory, focus, concentration. And then outside of that, that's like every patient sees me generally has all three with few exceptions. But then they have a whole side menu. And the way I define the syndrome is I call it, this is a constellation of symptoms that develops in temporal association to the vaccine or to COVID, right? Because they're long haul and vaccine injury are very similar. The differences for me is that the vaccine are on average sicker and on average have way more neuropathies. So like small fiber neuropathy, tingling, burning, pain, electric shock-like feelings, sometimes motor difficulties, trembling, fasciculations, even whole body convulsions. They also have lots of dysautonomia where their heart rates are out of control and their blood pressure doesn't respond appropriately. So that gives them a lot of fatigue, temperature dysregulation. I mean, the list is exhaustive. And then the cranial stuff, the vertigo, the dizziness, the tinnitus, the ringing in the ears. And these patients are so sick. And the mechanisms underlying these symptoms, we've identified about 6 different pathophysiologic mechanisms. And so, but there's so little research, right? The entire country, there's long haul clinics, there's no vaccine injury clinic, right? That's my clinic. And by the way, can I plug my clinic in case anyone out there needs help? I mean, it's basically drpierrekory.com. So drpierrekory.com. And me and my partner, we really focus on these syndromes, and we're probably managing over 400 between us patients at this point. You can see my drpierrekory.com on my Twitter. And, so we have a lot of these patients, and the research into treatment is just absolutely abhorrent. There's very little research. There's basically no clinical trials. And hey, Donna, unsurprisingly, the one study that I heard our government was funding into treatment of long haul, wait for it, Paxlovid.
Of course,
exactly. I mean, the system, the results that is produced from the system is based on how it's designed, right? And so, I mean, that's of course they're going to study Paxlovid. But so what we end up doing is we end up having to do sequential trials of therapy because of the mechanisms. I'm finding that in patients, they have numerous mechanisms going on. And so we choose therapies that counteract those disturbed, the disturbed pathophysiology. But there's about 5 or 6 disturbances that we see. And so sometimes I have to have patients on a few different therapies. Nothing I do works in everybody, but some work in a lot. And so I'm always able to get someone better to some extent, sometimes large extent, sometimes much more modest. I have a couple of patients who are almost impossible to treat because almost anything you do with them makes them sicker. They're so fragile. It's a real challenge.
Like their immune systems.
Yeah, it's their nervous system, the immune system that's all activated, and like we just have to go real slow and start real low on certain treatments. I see a lot of patients with medication sensitivities, where you really just got to be very, very gentle with them. And but we do have lots of success. I would say ivermectin's a mainstay. It's probably my most successful medicine in long haul, I would say, or post-vax. I would say 70% of my patients respond to ivermectin. The 30% that don't are much harder to treat. In fact, when I hear back from a patient that they didn't feel better on ivermectin, I'm like, oh boy, because I know the road is going to be long. But it's a really complex disease. But I'll just finish by saying, I left the system. I understood that this is another major epidemic and that no one knows how to treat it. And so I really like my new sort of profession. I'm focusing now, and it's almost a 180 degree from what the doctor I was. I mean, I used to run ICUs. I took care of the dying, and now I'm taking care of the complex, chronically ill. And I'm almost learn medicine.
I was just going to say, it sounds to me like what you're doing is the practice of medicine instead of the following of protocols that are handed down to you bullet by the people benefiting from those protocols. And what you're doing is the art of practicing medicine, which is assessing the person.
I got to tell you, I love doing this because it's really like old school gumshoe medicine. It's about experience, using judgment and prudence and knowledge of pathophysiology. Like, I'm not sitting around waiting for some manipulated randomized controlled trial to tell me to give my patients Paxlovid. I mean, that's an absolute joke. It's an absolute joke. So yeah.
And if people really understood what was driving, their giant hospitals and clinics and your local Walgreens or anything like that, then just understanding that there's a different way out there is so reassuring. And I would love to end on an optimistic note, because unfortunately there are too many people suffering, but people like you are helping them. And so if anybody unfortunately needs that kind of help, then please check out drpierrekory.com. Thank you so much for being here with us today. Is there anything else you'd like to add, or where can the audience find you?
Great to talk to you. Great to meet you. And I want to thank you for your work. I love your Substack. You're a warrior out there with us, and we need more voices, calling out the corruption, really. So
yeah, absolutely. And we can't stop. It's like you're on autopilot almost. You know what you need to do every day, and you wake up and you do it.
Am I going to have to do this for the rest of my life?
I hope that you will enjoy your relationship with your patients on a one-to-one level for the rest of your career. Let's put it that way.
Yeah.
How does that sound?
Patients, I would, if I could reduce my life to just me and my patients, that would be great. But
you're saying the fight, the propaganda. Listen, we need more voices, more journalists, more media, more alternative new media, and we're just going to keep plugging away at it, because that's all we can do, because I refuse to let my kids take this world that we're living in without understanding that there's a new way forward and joining with those people who are forging ahead.
You got it. It's really, we got to worry about ourselves and certainly our children, man. This has to stop.
Absolutely. Yeah. So, it's sick. Definitely. And I want them to be about health. So thank you so much. And it was wonderful to speak with you.
Definitely. All right. Take care, Tano.